Hi everyone, I'm Dr. Millie. I'm from Wound Team Jagaan. I'll be sharing about wound dressing solution and also type of dressing. First of all, you need to know the definition of the wound cleansing solution. There are two types of solution. One are non-antiseptic, one are antiseptic solution. Wound cleansing is a process which we remove the inflammatory contaminants from the wound bed. These contaminants can impede healing and also increase risk of infection. So contaminants are necrotic tissue, excessive exudate, foreign objects such as suture or staplers, or other foreign objects that is in the particular wound bed, infected tissue. So all these solutions are used for wound cleansing to cleanse the wound bed. It can be either non-antiseptic or antiseptic. So non-antiseptic solution includes two types which we commonly use, which is normal saline and water for irrigation. For normal saline, it is always a preferred cleanser because it's more physiological comparatively to other form of dressing. So any type of wound, it is suitable to use normal saline dressing. However, it can't be effective in dirty or necrotic wound and also not advisable in MRSA and Pseudomonas infected wound. And to be remembered, every bottle of normal saline dress we have opened, we have to use within 24 hours. Another non-antiseptic solution are water for irrigation. It is less physiological compared to normal saline, but safe to use. This solution can be used for MRSA and also Pseudomonas infected wound. There are a few types of antiseptic solution. First of all, antiseptic solutions are very suitable to clean wounds that are dirty or infected. There are few antiseptic solutions here. One are Chlorhexidine Gluconate, superoxide solution, polyhexamethylene biguanate PHMB solution. I'll be explaining them in detail soon. First, Chlorhexidine Gluconate 1 in 200 in aqueous solution is actually readily available anywhere and is effective against gram-positive bacteria, fungi, and also envelope virus. For gram-negative bacteria, it is less effective. This solution has bactericidal and also bacteriostatic action. So, as I said, it's very readily available. Superoxide solution, usually we see them in the form of such as dermacin and also hydrocin. It is a group bactericidal, virucidal, fungicidal, and spongylocidal solution. It can block the inflammatory process, remove the biofilm, which is also a foreign object that prevent healing process. Two components of this solution are oxidized water and chlorine. Oxidized water can be broken down to oxygen, ozone, and other oxidized species. Why this is not usually used? Because we have to buy it and it's costly. Polyhexamethylene biguanate PHMB solution, usually we call it a brand name called Protosan. It is helpful in soften and remove the slough. It can remove and reduce the biofilm formation, less painful comparatively to superoxide solution. However, it's very costly. There are few solutions that are actually cytotoxic to use for wound cleansing. However, a short-term use may be permissible for a particular wound. Such as povidone iodine, hydrogen peroxide, sodium hypochlorite, acetic acid, usol. Okay, thank you very much. This is about wound cleansing solution. The next I'll be sharing regarding type of dressing. There are first of all, you need to know the purpose of dressing. Secondary, There are a lot of categories of dressing. I'll elaborate later. Dressing purpose is to protect wound from trauma and microbial contaminant, reduce pain, maintain temperature and moisture of wound, absorb drainage and debride the wound, control and prevent hemorrhage, such as pressure dressing, provide psychological comfort. The ideal and also optimal dressing must have the criteria below. First of all, remove excessive exudate, have to be waterproof, maintain moist wound healing environment, trauma protection, allow gaseous exchange if appropriate, non-adherent, provide barrier to pathogen, and safe and easy to use, provide thermal insulation. There are two types of dressing category. First of all is conventional, and second, modern or advanced dressing. Conventional dressing will be using gauze, gumji, soak with normal saline, or any type of antiseptic solution. I'll be elaborating more on modern or advanced dressing. First type of dressing will be film. Its purpose is to protect against contaminant and friction, maintain moist surfaces, prevent evaporation, facilitate assessment. Its advantage include adherent, transparent with measuring grid, bacterial barrier, waterproof, breathable. Its disadvantage is it may collect fluid, possible of stripping away of newly formed epithelium when removal. Its practical use include apply the film over the site, make sure there is no air under it. To remove the film, stretch the film and pull slowly from the edges. Frequency of dressing will be 2 to 5 days depending on the wound. Example of film will be like Tegaderm or Opsite dressing. Second type of dressing, Hydrogel. It rehydrates, debride, and dislodge the wound, promote moist healing, cavity filling. More advantage of it is comfortable, provide moist environment and reduce pain, rehydrate scar, dislodging agent, promoting granulation. Its disadvantage include it requires secondary dressing and it might cause maceration around the skin, around the wound because of its rehydrating properties. So usually we will apply the hydrogel over the wound bed as primary dressing and we'll apply secondary dressing to cover it. Frequency of dressing will be 2 to 3 days. Example of hydrogel include sarcoserol dressing, intrasite dressing. Third, hydrocolloid dressing. It provides moist environment, absorbs the exudate, and it's also a bacterial barrier. It cleans, debride by autolysis, easy to use, very cost effective, promotes granulation tissue, effective for low to moderate exudating wound, and is waterproof. Its disadvantage include it might have unpleasant odor and also forms a yellow liquid gel, difficult to use in a cavity because it is always in a sheet form, macerated of the skin around the wound because of its rehydrating properties. It usually will apply the adhesive side onto the wound, without touching the wound bed. The yellow liquid is seen after the dressing is left in situ, which need to be cleansed during the next dressing, and usually we'll have to change between 2 to 5 days. Example of hydrocolloid dressing will be duodenum dressing, suprasalt H dressing. Calcium alginate dressing, it absorbs wound exudate and maintain moisture, is economical and easy to apply, is biodegradable, is hemostatic properties. It's not helpful for any dry wounds, need secondary dressing. So it available in sheet or rope form, effective to stop bleeding, the residue of the biodegradable product has to be cleansed during the next cleansing process. Usually we change 2 to 5 days. So example of calcium arginate will be Composite. Fifth, foam dressing. They are very absorbent, very cushioning or offloading uses. It's comfort to body contour, designed for cavity wound, highly absorbent, provide protection, bacterial and waterproof. It can adhere to wound if the exudate dries out. We usually use foam dressing as a secondary dressing or a cavity filler. Usually we change 2 to 3 days or longer if its use is for offloading. Hydrofiber, it manages heavily exudating wound. It maintains moisture, healing environment, longer wear time, comfortable, non-traumatic or torn removal. It reduces risk of maceration, can be used in infected wound, not helpful for dry wound, need secondary dressing. Hydrofiber will become gel-like layer which can be easily removed and cleansed during the next dressing. Usually we change 2 to 5 days. Example, like Aquacel. Charcoal dressing are odor absorbent, reduce odor, need secondary dressing. Usually we change every 2 days. Silver dressing are to reduce bacterial bioburden in the infected wound. Is locally acting, no known resistant yet, and is bactericidal. Some silver dressing do discolor the wound. Place the dressing with the side with silver facing the wound bed, and we change every 2 to 3 days. There are polymeric membrane dressing to manage moisture imbalance from dry to moderate. Antiseptic properties, hexamethylene, help to cleanse the wound when applied, and also offloading property. It's not for heavily exudative wound. Usually we change from 2 to 5 days. Composite dressing are combination of 2 types of dressing material. Actually, the purpose will depend on what we use. Advantages, it will be multifunctional. Disadvantages, it will be individual component listed above. I will change the dressing every 2 to 5 days. There are a few other advanced dressing which are used, such as collagen, matrix and regenerative dressing, culture epidermis, growth factor, and stem cell. So take-home message will be, know your dressing material well and use it judiciously. All wound need to be cleansed thoroughly before applying any type of dressing material. Here are my references. Thank you.